everyone. Good afternoon, and good afternoon to all the participants of this Congress. And I hope my talk would a bit ignite you about different perspectives. And it's very lucky that my topic is very much not much related to the subjects directly, but is a food for thoughts that I would like to give to everyone so that we can perhaps think beyond the mental health, oral health, or the schools in the mountainous area in Japan. So I think it's a good opportunity that I am in the middle so that I can also draw your attention and also allow you to reflect from the previous presentation. I would tell you a little bit why I'm here. And actually, the reason that I'm here is also indicated by Dr. Ampon this morning at her last message in her slide. The message was one of the important key success factors of today global health is international partnership. And I am from a policy center of the Asian Institute of Technology, and you might be surprised why I'm here, because there is not related to the health issues, but actually policy is very important instrument to advance the strategies, advance the treatment, advance the rehabilitation, and also advancing the look after of the children which is falling into the disadvantaged group. So the reason I'm here is because AIT worked with the government of Bangladesh in few months ago, and the government of Bangladesh have got the loan money from the World Bank to improve the service for the PWD, people with disabilities. And the government of Bangladesh asked my center how we can do it, because in Bangladesh they also lack of a very poor service in a holistic approach to give the service to the PWD, people with disabilities. So I said that in Thailand we have many institutions to help in order to share with other colleagues, other therapists, also other medical doctors, and also other nurses in Bangladesh, and also other social workers, that how things can be improved, taking the lesson learned from the same developing countries. So I introduced to them that among many institutions in Thailand, I also introduced Rajanukul of Dr. Ampon and many other colleagues here, that we use the institutions as a hub for expanding the lesson learned from different countries. And the lesson learned, it doesn't mean it's the end of the story, but the lesson learned can also allow the people apply what happening in the field, and also they can apply and also adjust what they are doing. So we introduced Rajanukul and also the many other institutions in Thailand to showcase how things can be dealt with the ID children. So when we share the experience with the therapists and also social worker in Bangladesh, we show them with this perspective. Because at the end of the day, I believe that we people would like to have the ID children and also the intellectual disability persons to be part of the society. And they also should produce to contribute as much as they can to the development of the economic in such countries. So how we do that? I think we have to fix it by various mechanics. The mental health department alone, the specialized center alone, may not be able to make it succeed when we are looking at the global health. But we also have to expand. We have to have also open mind to look at those things in different perspectives. Not only from the perspective of the medical doctors, public health officers, but from the perspective of educators, from the perspective of technologists, from the perspective of employers, how the society, as much as they can, include them into the environment that they are happy to be. For example, if we are having the education program, we do need the innovativeness in order to, like what Rajanugun is doing, introduce the learning technology that very appropriate to the ID children. So we would also expand our perspective into different segment of the societies. And we have been working a lot. And what I heard, that I'm very glad that one of the policies, how to involve the family, the parents, into the treatment, into the rehab, and also into the caretaking, that they can live very happily in the society. So these are the dynamism that it will not be stopped it's go forever. Now, from the policy point of view, what I could perhaps highlight could be 4 pillars. The first one is to enhance the intellectual ability. So perhaps we also need to look at the education perspective, education domain, education dimensions. And also we have to look at the healthcare function. And when we are talking about the healthcare function, we cannot just talking about the treatment or rehab, but also look at the whole system, how we can integrate them, and also take care of them until they no longer in this earth. The third one is very important. Now you can see that there is a importance of the community, that they have to engage so that the resources can be shared, the budget can be saved, and also the effectiveness can be higher. So we engage the people surrounding them to take care of them after we diagnose, after we treat them, after we rehab them. So we release them into the community so that the environment look after them. And last but not the least, in my own opinion, the welfare perspective, quality of life is becoming more and more, so that the ID children become empowered adults. They do not create the obstacle or limitation to the society and to the government, but contribute positively to the society. So basically, if I would raise, they need reform. And I believe that we need reform, and reform is being take place in our countries. Number 2, we need to look at the good governance of the system, how we promote participation, how we promote information sharing, how we promote appropriate regulations, how we promote equity and equality of the treatment, for example. And last but not least, and I think this is the most important, we have to break through the culture. We have to break through the culture to the culture of the service, so that, the recipients, the customers, the patients, the parents are satisfied, and also they are having positive response to what we as a government giving to them. And if we are looking at the key success factors, so these are the key success factors. The integration of plans. We perhaps need to draw the attention to the policy research, which is bridge between the technical research and policy research, that not only look at the national policy perspective, but also the local policy perspective when we are looking at the community and we are looking at the role of the local government. So that is the policy perspective. Macro level may not be enough, but perhaps we also need the micro level inputs. The second one, and I think this is very, very popular, especially in ASEAN and also many other countries in Asia, that we need to harmonize the things. The standard of operation, we have to harmonize the service care. And at the end of the day, we are looking at, and this is not to control the service providers, but we are looking at the unity of practice. And I think we are all responsible for this, starting from how we are going to harmonize the policies at the national level, at the micro level, at the local level, how we are going to stop and look at the guideline, how we are going to make the guideline as one, so that everybody practice the same. And the third one, how we learn from the evidence base. So evidence base not only for on the technical perspective, but also in terms of the policy practice and the practice that is best for us, so how we can take that as a lesson learned so that we can also cultivate the new way of doing things. And last but not least, we are looking at the participation engagement. So everybody would like to comply and agree with the practice that we should do. And this is very classical, I think. We need more coordination among agencies. And this coordination, we, as the public health people, we perhaps need to voice more concern on this in order to break down the bureaucracy so that information can share, the budget can be streamlined, so we save money of the government by combining into the programs-based planning so that things can be go at once as a cluster and also right to the point. And as mentioned by Dr. Wu this morning, I mean the first presenter, there is a diversification of needs. How we are going to customize our service based on the problem in different areas. And that perhaps we need to help our health department, our government, our education department to think about. So perhaps we need to look at the customization. Policy at the national alone may not be able to help us much because different areas having different problem scenario is also problem circumstances is also different. And last, I think but not least, is very popular now is how to draw the resources at the local level to help us. The government doesn't have money all the time, but the local government now becomes stronger. So how we work with the municipalities, how we work with the local government so that they share funds. And this creates sense of belonging. So if they are participating, we hope that in the future they feel belong to these jobs and they also contribute more. So in conclusion, the care for IDP children needs to look at all dimensions. Number two, resource and budget should be shared and should be united. So it saves money for the countries. It saves our resources. And the third, to change the way that we service things, we need to work cross-functional. We learn from every segment of the government so that we share each other the experience and also practice. Last but not least, we have to make sure that we know who is doing what. Thank you very much. I hope this also gives food for thought for you.